undergraduate curriculums in mind. So hopefully they are pitched at the right level for everybody. You'll get a certificate on completion. For the certificate, you do need to attend around 80% of the courses. This will be recorded by feedback, and this can be accessed by filling in a QR code that will be present at the end of every session. But before you fill in that form, we do have a pre-course form that you can access using this QR code. And this is just to give us a good understanding of where everyone is at the moment, just to allow us to cater this course appropriately in future and to see if we're making a good difference when we look at your scores here and your scores at the end. It's a pretty short form, so if everyone could just take a minute or two to fill this in, that would be great. Okay, so this session is going to be slightly shorter and snappier than the others that we have over the next few weeks. I'm essentially just going to try to provide a general overview of the key structures that will be referenced in greater detail by the experts later, just to get you used to the anatomy and some of the terms that will be used so that you have a good basis to work upon and build upon for the rest of the course. So as this is a neuroanatomy course, obviously we are focusing on the nervous system, which can be split into the central and the peripheral nervous system. We will be focusing on the central nervous system, so the spine and the brain. And that's how you can split that up into the cranial and spinal portion. Now this session will focus on the basics of cranial anatomy. However, the final two sessions of this course will cover spinal anatomy comprehensively, so no need to worry about that, that will be covered.
I don't know if it's just me, but I don't hear anything or see anything. So I don't know if everything is going according to
Same
plan.
here.
Same.
Same here.
Yeah.
We can't see him.
Also,
Yeah, same for me. Also, I
Okay.
keep getting notifications every time someone enters the lobby and it covers the screen.
Yeah. So that's an issue that can be easily fixed, but someone has to have a control over the meeting. I would suggest that everyone who's not presenting makes themselves an attendee or tries to make people they know are not presenting attendees.
If you click the participant list, it stops it from covering your screen. It just goes to like the right-hand side.
Hey guys, sorry about the meeting. It's just a quick technical issue that we're sorting out. Should be ready in just under 5 minutes. All right.
Sorry about that, guys. Hopefully everyone can hear me. I'm on night, so I'm doing this from a hospital computer, so there may be a few technical issues, but hopefully that's the last one. So I think we had just covered the layers of the scalp, and we just finished talking about the periosteum. So under the scalp, of course, we have the bones that form the skull. And the skull can essentially be separated into three main components. So you have the cranial roof, you have the base, the cranial base, and then you have the facial bones. We'll be focusing on the former two and less on the facial bones during this course. So that's what we'll be looking at. So starting off with the bones of the calvarium or the bones of the cranial roof. These are essentially named after the lobes that are underneath them. So for example, you have the frontal bone that covers the frontal lobe, the two parietal bones that cover the parietal lobe, and the occipital bone at the back. Now at the base, again, we have a lot of the bones that are named after the lobes they cover. So the frontal, temporal, parietal, and occipital. And we have two extra bones that are really important, which are the ethmoid and sphenoid bones. And these bones here, so the sphenoid and the ethmoid bones, are really important. So as you can see, there's multiple little holes in them, and these are called foramina. And through these really important structures, including the cranial nerves and various vessels that supply the face and neck, pass through. And that will be covered in our skull base lecture, which will cover the cranial nerves and all the important things that pass through. But this area is really high yield for exams, and also is, of course, very important in neurology and neurosurgery. And this area can be split into essentially three different areas. So you have the anterior cranial fossae, the middle cranial fossae, which is those two are bounded by the sphenoid bone. And then you have the middle and the posterior that form a boundary at the parietal bone. So as with any bone in the body, these are joined together with joints. And in the skull, we call these joints sutures. And there are three main ones. So you have the coronal suture, which is the most anterior one here. You have the sagittal suture, which is here in the midline. And then you have the lambdoid suture. So the coronal suture fuses the frontal bone to the two parietal bones. The sagittal suture fuses the two parietal bones here in the midline. And then the lambdoid suture fuses the parietal bones to the occipital bones. Now, the coronal and the sagittal suture, I just like to focus on here because these are words that we also use when we're talking about planes. So when we're looking at scans, when we're looking at slices of brain, it's important that we orientate ourselves. And one way that we can do that is by working out which plane we're in. And these are terms that you will hear used repeatedly during this course. So this is the coronal plane. And if you imagine where the coronal suture is, if you were to slice straight down, that would be a coronal plane slice. Same for the sagittal plane. Again, if you were to slice in a longitudinal fashion through the midline, that would be a sagittal plane, sagittal slice. And then you have the transverse or a horizontal plane there. These are just terms that I would want you to familiarize yourself with, just so that in the future when we're looking at scans or at dissections, you can understand what way we're looking at the brain. So under this bone, we have the dural coverings, and these are what overlie the brain. So there are three of them, and the outermost one is the dura mater, Latin for hard mother, and that's because this is the thickest and toughest of the three coverings. So it's essentially two layers of connective tissue sheets. There's the periosteal layer, and that's what lines the inner surface of the bones that we've just discussed, and is strongly adherent to the sutures. And then we have the meningeal layer, which is deep to that. And this is the only layer that's present within the vertebral column. And between these two layers is where you find the dural venous sinuses. So essentially where venous blood from the brain pulls into here and travels through the sinuses into the internal jugular vein. And this is what we'll be discussing in our lecture on Tuesday next week. We'll be looking at both the venous drainage and arterial supply of the brain. And of these two dural folds that we've talked about, the innermost layer reflects in on itself to form dural folds that are a different way of separating the cranial cavity. So in this picture here, we can see the three main dural folds. So we've got the falx cerebri here, and this separates the two cerebral hemispheres. Then you have the tentorium cerebelli here, and this separates the cerebrum from the cerebellum that will be sat in this little pocket here. And then you have the falx cerebelli, which is similar to the falx cerebri in that it separates the two cerebellar hemispheres. And again, you can see these dural sinuses within these dural folds, and that's where the venous blood will pool, eventually traveling down into the IJV. And it's important to understand how the dura adheres within the brain, because when we see images like this of a bleed, it can give us some insight into where exactly the bleed is happening. So as I said, the dura is strongly adherent to the sutures. So if there's a bleed that happens outside the dura but within the skull, you can see that it will be limited by the suture lines, and therefore it will form this sort of biconvex shape. Whereas if it's underneath the dura, so a subdural bleed, it's going to form a crescent shape because it's not limited by those sutures. Okay, so beneath the dura, the next layer is the arachnoid mater, so spider mother, and this is a vascular connective tissue layer. And just beneath this is where something that's very important is stored, which is the cerebral spinal fluid, which is a fluid that essentially acts to cushion the brain. And again, this will be discussed on Tuesday in far more detail, but just to give you a basic understanding. And there are small projections of the arachnoid mater back into the dura, known as granulations, that allow the CSF to travel back into those venous sinuses that we were talking about, to allow that to then leave the brain. Constant flow of production of CSF, which then flows out. And as we're discussing this next week, I won't go into too much detail of the exact pathway, but just to show you that here in the subarachnoid space is where the CSF will be. And here's one of these arachnoid granulations that will then move the CSF out into the dural sinus of venous blood, where it can then move back out into the IJV and out. Okay, so the final dural layer is the pia mater, which is tender mother in Latin, and this is because this is the most fragile, very thin layer of the dura, and this is tightly adhered to the surface of the brain and the spinal cord, and it follows the contours of the brain. So if we just look at this diagram, you can see that you've got the dura, which is, as I've mentioned, adherent to the bone, and you've got the arachnoid mater underneath that, but the pia mater follows all of the curves and bends of the brain. And again, here you've got the arachnoid granulations back into a dural sinus. So this is quite a good diagram, just summarizing the things that we've discussed before, the layers of the scalp and then the layers of the dura. So underneath all of that, we have the cerebral cortex, which is a very convoluted piece of tissue with a number of bends and grooves. And there are terms that we use to discuss this. So we have the gyri, or a singular gyrus, which are these outward rounded ridges of cortex. And then in between in these grooves, we have the sulci, or an individual sulcus. And these are quite important anatomical landmarks that we can use when we're looking, again, at a dissection or at a scan, just to help us orientate ourselves to where we are. So there are particular sulci and gyri that it's important to know. Giulio, one of our fellows, will be discussing the frontal lobe, and he's really good at sort of explaining this anatomy just to cover some of the main ones in this section. We have the central sulcus here, which separates, as we've mentioned before, the frontal lobe and the parietal lobe. And then we have the lateral sulcus here, which separates the frontal and parietal lobe from the temporal lobe. And these are things that you can look for to kind of help yourself understand if, for example, a lesion or a bleed, to understand exactly where in the brain, or well, which lobe it is in the brain. And then surrounding these sulci are very important gyri. So particularly with the central sulcus, we have the precentral gyrus, which is just in front of it in the frontal lobe. And this is the location of the primary motor cortex, so this is incredibly important for movement. And just behind it, and they're closely linked because they work closely together, you have the postcentral gyrus, which is part of the parietal lobe and the location of the primary somatosensory cortex. So it's important there that motor and sensation are so close together. Okay, and then just under the superior temporal gyrus, we have the, underneath the lateral sulcus, we have the superior temporal gyrus, which is really important for the reception and processing of sound here in the temporal lobe. So we discussed the lobes a little bit, but as I mentioned, these are all essentially named with relation to the bones that overlie. So we have four main lobes: the frontal, parietal, separated here by the central sulcus, temporal here, and then posteriorly we have the occipital lobe. So these will be covered again in great detail in the rest of the course, but just to give you some insight into what each of the lobes do. In the frontal lobe, we have the higher cognitive function, personality, mood, social conduct, language, and of course movement, having seen the precentral gyrus. And then in the parietal lobe, that's where the postcentral gyrus is, so we have processing of important sensory information, touch, taste, temperature, and particularly proprioception and spatial sense. Temporal lobe, as we've mentioned, has the area that's really important for hearing and language, but also is important for memory. And finally, the occipital lobe, I think most people will know, is key for vision. So when we look at a slice of the brain, and this is a coronal slice, we'll understand that there are different, I guess, colours of matter. So you'll have the grey matter on the outside and the white matter on the inside. And the grey matter, which forms the surface, is where cell bodies take place and is essentially where the more eloquent, important things are stored and happen. So all of your cognition, etc., will happen here. Whereas the white matter is primarily glial cells and myelinated axons. So this is where the connections between the different lobes will take place here. However, beneath the cerebral cortex, there is more than just white matter, and we have a number of subcortical structures. So this is a pretty simple diagram, and we'll cover this, as I mentioned, in the course. So we have sections on each of these important structures. But just to quickly go over them, we have the putamen and caudate and globus pallidus, and these are parts of the basal ganglia. We have the thalamus over here, the hippocampus and the amygdala, which are part of the limbic system. So the basal ganglia is an area that controls and regulates voluntary movements, whereas the thalamus is a relay station, so receives a lot of important input from all of the sensory areas and relays that information to other areas of the cerebral cortex. So it's a relay station takes in information and gives it back out to areas where it's useful. The hypothalamus is involved in sort of basic functions like eating, sex, and produces a lot of sex and growth stress-related hormones that act on the pituitary and essentially control the body's endocrine function. And finally, we have the limbic system, which is known for being involved in emotion, and particularly the hippocampus, which is important for event memory. This is a very quick overview, and these will be discussed later on in the course in greater detail. So outside of the cerebrum, there are still pretty important structures in the rest of the brain. And here we're going to talk about the cerebellum and the brainstem. So the cerebellum, which is Latin for the little brain, just sits underneath the cerebrum and is involved in sort of fine motor movement. So any dysfunction here can result in very uncoordinated movement. And it's often said that people with cerebellar dysfunction act as if they're performing a particular movement for the first time. So here, as I mentioned, it's practice-related memory and fine-tuning movement. And just anterior to the cerebellum, we have the brainstem. So here's the thalamus, one of the subcortical structures that we discussed before. And beneath it, we have the brainstem that can be separated into three main areas. So we have the midbrain, which is the most superior area, the pons, which is Latin for bridge, and essentially connects the cerebellum to the cerebrum to the cerebellum. So as you can imagine, quite important motor structures will pass through here to help fine-tune that motor movement. And just underneath it, we have the medulla, which connects the brainstem to the spinal cord. These little outpouchings here are cranial nerves. So most of our cranial nerves come from the brainstem and then pass through the foramina that we looked at earlier. And one really important thing that does take place in the brainstem is the control of autonomic functions, so things like your breathing, heart rate, etc. So when, for example, if you're in hospital and you hear people talking about coning, essentially what they're talking about is the cerebellum passing through the foramen magnum, which is the hole at the base of the skull, and putting pressure on the brainstem. And this will cause disruption of autonomic function and can cause drop in conscious level and disruption to your breathing and heart rate, which can lead to death. So that's why that's something that people get quite concerned about in hospital. And then just a final quick slide, looking at just a bit more terminology that we may use. So I know most of you will have had some anatomy teaching, so we'll be used to hearing the terms lateral, medial, superior, inferior, posterior, anterior. But when we're talking about neuroanatomy, terms that we may also use are rostral, ventral, caudal, and dorsal. And people can find this a little bit confusing because these mean slightly different things depending on where in the brain you are. So as you can see with this little axis, above this line, dorsal is pointing in a completely different direction to beneath it. And it's because this terminology, basically because of the way that the brain develops, which is that it kind of curves round on itself like this, that axis also will curve round on itself, meaning that dorsal, which here is almost pointing posteriorly in the midbrain, starts to mean superiorly in the cerebrum. So this is something that it's important to sort of familiarize yourself with, because these are terms that will be used in the rest of the course and may be a little bit confusing if you're not used to them. So that was just a bit of a whistle-stop tour through sort of the basics of neuroanatomy, just to get you familiarized with the different areas and what we're going to discuss in great detail later on. As you can see, there's a lot to cover, and that's why we've got 13 sessions, each covering very small or significant parts of the brain, and just to make sure that each part is addressed in detail. Hopefully this little quick session will help you feel a bit more comfortable with the terms used and the areas that we cover later on. So if you have any questions, I believe there's a chat box, or you can raise your hand, or you can message us on our Twitter, either the Imperial or the Barts Twitter afterwards, just in case, and we can answer questions there. And as mentioned, it's important to log your feedback and attendance for all of these courses to make sure that you're able to get your certificate at the end that you can put in your portfolios or CVs as proof of attendance. So this is the QR code for the feedback form. Any and all feedback is really useful, so we can make sure that these sessions help you guys out. So thank you all. This has been a great turnout for the first session, and I look forward to seeing you all for the rest of them. Hopefully you find it really useful.
Guys, when filling in the feedback form, there's nowhere to input your name. It's just the name of the tutor in the session, and that's it. Do you have any ideas where we're supposed to write our names?
One second, I'll just ask Lana, who made the feedback forms, and then get back to you. 5 seconds.
Okay, thank you.
Hi, I think you don't need your name for the feedback form for this session. Lana's going to look into it just to tighten up that little bit for the next session. But thank you for filling in the feedback. So for this session, I think we have all the names of people on the list because we invited you all. So we have evidence of you all attending, but we'll tighten that up for the next session. So thank you so much for mentioning that. As I mentioned, this is the first time we're doing this course, so there still are a bit of troubleshooting things.
That's all right. Thank you.
Hi, Chidera, it's Abby. I just have a quick question, just thinking about moving forwards. Just wondering whether the presentations will be made available or whether it's worth taking some notes as we go.
So we are going to try to record each session. It's kind of dependent on the person speaking as to whether they are comfortable or not. But they will be all the ones that we are able to record will be available on completion of the course, so at the end. If you're currently revising, I would advise as you go along to take your own notes, which you will then be able to supplement with the recorded sessions, which will be uploaded at the end in roughly 12 weeks' time.
Lovely, thanks, Chidera.
Hiya, Doc Raymond. You have your hands up. Are you able to ask a question?